Hi, welcome to Ketobiography. I'm your host, Robyn Dobbins. Our next guest is one of the leading clinical voices behind the emerging field of metabolic psychiatry. With all that he does in the world of mental health, you'd think he's a psychiatrist, but he's actually a cardiologist and lipidologist with over 20 years of experience and a deep passion for healing and prevention. As medical director for Metabolic Mind, Bazooki Group, and Coalition for Metabolic Health, he's helping build a nonprofit ecosystem that brings ketogenic and other metabolic therapies into everyday psychiatric care and pushes metabolic health toward the center of modern medicine. Please welcome Dr. Bret Scher to Ketobiography. Hello and welcome. I'm so glad you're here.
Thank you, Robyn. It's wonderful to be here. I really appreciate it.
Well, I had this idea in my head that I would invite people who were on the Cholesterol Code documentary to my podcast. So I reached out to Jen Eisenhart, the producer, who was last week's guest, and I said, "Hey, can you hook me up with some people that were in the film and so I can do this little mini series of guests?" And she gives me this list of names, and I'm reading over it, and I'm like, "Ooh, wow, that's like a major person." And like I look up to this person, and I look up to and I got like super nervous, and I wrote back to her, and I was like, I can't believe this list of names, but I also really don't know what I was expected when I asked that question, and you answered it properly. So I'm just thankful that you made the time for me, and excuse me for being a little I don't know. I guess nerves. Nerves is maybe the correct word for it. But I have really looked up to you for a long time, and I'm just really appreciative that you could be here with me today.
Of course. I mean, it's truly my pleasure. And look, I mean, I look up to you so much. I mean, you sharing your story for the world in that documentary, and really, in my mind, your story takes center stage. I mean, it's just so amazing. The footage is incredible, and to be that vulnerable to, put so much of yourself out there and so raw is it really commendable. So thank you for doing that.
Yeah, we can just keep going back and forth, buttering each other up. I think that's what we'll spend an hour doing.
Yeah, I think people will get tired of that real quick. So.
Perhaps, I don't know, but this is a little after we talk a little while, maybe you could give me some pointers on this. But we're all everyday real people, and to have these feelings of like, looking up to someone because of something that they've done is. I feel very new to that perspective to have people come to me and say those kinds of things. So I still really don't know how to receive that information. You're ahead of the curve on that, so maybe you can give me some pointers as we go along.
Well, there's that old saying that we all put our pants on one leg at a time or whatever, right? Like we're all the same. I had to go pick up my dog poop this morning, right, in the backyard. Like that's everyday things. We're all normal people.
We're all just regular people around here. Yes, it's just a hard concept to I don't know, grasp. So let's get into it a little bit. I do want to talk, of course, about the cholesterol code, but I really want to talk about you. Like that's what I usually do here on my show is I talk about that. I want people to tell their story in their words. And I mean, to me, as someone who has mental health issues, you're in this role with Metabolic Mind, which kind of doesn't make sense because you're a cardiologist, but here you are, and you've certainly taken this role on with gusto and passion. So I'd like to hear kind of your journey through, what you set out to do. You became a doctor for a reason, and then how you ended up where you are now before we get into movie stuff.
Yeah, I mean, I guess the short-ish version is I got into cardiology to prevent heart disease, right? And to hopefully the tools we have for stents and open heart surgery and transplants are absolutely amazing. And if anybody needs one, it is incredible what they can receive. But wouldn't it be so much better if we could prevent the majority of those people even getting to that place in the first place? And so that was my goal. And then just getting out into practice showed me I was just woefully trained to make that happen. The modern medicine, the standard of care is just really poor at prevention. So it led me to other avenues to try and find, what am I missing? What can we be doing better? And that's where I really got focused on metabolic health and low carb and ketogenic interventions for metabolic health. And Not that it is the only intervention, but for me, it was the most important intervention that nobody was talking about. And I say nobody, but obviously, Eric Westman had already done research, and Yancey had already done research, and Gary Tubbs and Nina Teicholz had written books about it. But within the medical world, it really wasn't talked about and really wasn't practiced, and certainly wasn't taught. So that's where I sort of felt like I need to start shouting this from the rooftops and making sure everybody understands. And I committed my practice to focusing on metabolic health and using ketogenic and low carb interventions to achieve that for those who were good candidates for it. And from there, got involved with Diet Doctor, where really when I joined at the time, the main goal was educating the world, clinicians and individuals, about the therapeutic interventions of carbohydrate reduction. And when I met Jan and the whole team at Bazooki Group and Metabolic Mind, I felt exactly like what you said. I'm a cardiologist. Like I can maybe help them find somebody, but gosh, once I saw what they were doing and the passion and just the commitment to really changing an entire field of medicine, and the suffering and that this could prevent and the lives it could restore, I was just, I'm all in. I don't care what my training's been. I don't care what my past has been. This is about educating clinicians and educating the world about the therapeutic interventions of ketogenic and therapy and carbohydrate reduction, which is exactly what I've committed my life to. And it just happened to be within the field of psychiatry. And so instead, I rely on Dr. Georgia E., Dr. Matthew Bernstein, Dr. Chris Palmer, Dr. Laurie Calabresi, Dr. Shivani Sethi, right? I'm relying on the experts and using their expertise to then help me communicate with the world. And gosh, I mean, what we've accomplished in, under 4 years, and how metabolic psychiatry has risen and how Metabolic Mind has grown, but also how just the field and the experts, these experts that I've named and so many more, and the lives that have been changed is already just so dramatic, and it's just increasing by the day. And it all started from, Jan's passion. You never, hopefully people know the family story with Matt Bazooki and having bipolar disorder, and, Jan and Dave trying to do everything they could to help him. And not until they found ketogenic therapy did he really change his life and get to full recovery. And you never want that to happen to anybody, but, in retrospect, thank goodness it happened to them, because Matt is just an amazing individual and back to his quote unquote normal self, as he says. And thank goodness it was Jan and Dave who are so passionate and philanthropic to really commit their time and resources to changing the world and changing the practice of medicine.
I couldn't agree more. Somebody asked me to describe Jan one time, and I'm like, she's everybody's mom. Like she got so passionate about what Matt was going through that she just grabbed all of us who were in that same situation and has helped all of us with that same amount of passion. I don't know how she has the energy to do what she does on a daily basis. And I know I met her at COSI, the very first COSI, so 2 years ago, and she ran up to me and gave me a hug, and I of course was a little taken aback that she did that, but she's like, I feel like I've just known you forever. And I do. I feel like she's just everybody's mom. She cares for us in the way that a mama bear would care for their babies. And it is. I'm very thankful that it's a weird statement to say, but I say it about myself all the time. Like, if I didn't have these mental health issues, I wouldn't be doing what I'm doing. I wouldn't eat the way I eat or do these things. And it's a constant reminder that I need to stay this way. But so, yeah, it's a weird statement to say, yeah, thank God it happened to them, but they were the right people. It worked out. It worked out for the right reasons. Right. And it's right. Turned into a much bigger movement. And thankfully, Matt's doing really well now. And we've all been able to benefit from that. And what you said also about like every single day somebody new comes up. Like, it seems like every single day there's a new doctor, a new voice, a new researcher, a new person that you're interviewing for Metabolic Mind. It's like, we've talked about the silos in metabolic psychiatry before, and now all of a sudden it's coming together, and it's just growing exponentially daily, and it's just very exciting. So who are some people that you've talked to recently that are bringing some new ideas to the field?
Well, so one interesting thing, I just had an interview with Dr. Megan Kirk Chang. And the reason I did is because of what's called the DIME study that was published. And this is, we sort of felt like, we were helping this field progress in research and kind of knew all the research that was happening. And then all of a sudden we heard about this study that we knew nothing about, right? We had no involvement in it. We didn't fund it. We weren't, involved in helping set it up or connect the researchers or anything. And we're like, wow, people are doing this research even without us. Like, that is amazing. And that's how this field is growing so much. It's growing by, other connections, which is exactly what we want. Like, by no means do we want to be the only ones doing this. We want everybody to be looking at this and doing it. So that was awesome. And more of those are sort of popping up. And, it's inspiring. Everybody has their own story. Everybody has their own reason for doing it. And in the end, it's all about helping people recover their lives. Psychiatry can do a lot of things, and it does a lot of things not so well. And a big one it doesn't do so well is giving people their full lives back as much as we would like. And that's something where this offers hope. Now, the research is early, of course. There's a lot of room to go. But the individual stories and the clinical experience is truly remarkable. And when the pilot trials and the clinical experience are moving the same direction, you've got to take note. And that's what we want, sort of doctors, therapists, nurse practitioners, dietitians, and everyday individuals. That's what we want everybody to see and to learn from, to see if this is right for them and how they could change their lives. So yeah, that was one interview that really helped open my eyes. And then even another recent one was Dr. Robyn Englehart. When we share information about the studies for bipolar disorder and schizophrenia, people always ask, well, what about for PTSD? What about for OCD? What about for anxiety, right? And we always have to say, look, the first answer is there's no research in that yet. But now Robyn Englehart is doing, PTSD research, and he's doing a pilot study, and based on his personal story and his experience, and now his research turning into his research passion. And again, it's just so inspiring, and learning how we can help so many other people with this intervention. It's pretty awestruck.
Yeah, and it's kind of hard to just piece it, like it's this diagnosis, and this like that's the way we think we should be thinking about things. And so I can see why that's a question that comes out, especially with people who are very in that system. But I don't think of it that way. I just like say mental health or neurological health, like it's brain health. And it stands to reason, if it works for this person with this thing, then it should work for this person with that thing, because it's still the brain. and yeah, so
and that's such an important concept, because it truly is brain health. Epilepsy, Alzheimer's, Parkinson's, bipolar disorder, schizophrenia, anxiety, OCD, it's all brain health. Unfortunately, if you want to talk about medical guidelines, insurance coverage, if you want to talk that language, you need the diagnosis. But in reality, it's exactly like you said, it's brain health.
I like that you just mentioned that, because I did mention in the introduction that you work with the Coalition for Metabolic Health. And I feel like that's one of the things, like that coalition is trying to get that kind of language in the lexicon for diagnosis and treatment. How is that working? And actually, you can back up a step and kind of explain that coalition a little bit, and then what some of the things they're doing.
Yeah, so the Coalition of Metabolic Health is a national group of clinicians and scientists and nonprofits and just committed advocates to making metabolic health center stage in healthcare, both in diagnosis, priority, treatment, and going to policy to make that happen. Not just education. Education, of course, is crucial and a passion of mine, but now taking the next step and trying to affect change through policy. So we just had the dietary guidelines that's talked about metabolic dysfunction, talked about specific dietary interventions for metabolic dysfunction, which talked about increasing protein, reducing the refined carbs and sugars. Such important changes. And then, NIH at the government level, what research are they funding? Well, they're going to start funding more metabolic health focused research. So having a role in any of these changes, even a tiny bit of a role, is just so important that we can, help educate people who are making these policies and educate people who are voting on this. And I think it's such an important role, and we've already done so much. As a coalition, we're barely 6 months old, but we've had so many, op-eds published, and we've had papers up on our website that we've shared with the congressmen and representatives, and we've been there lobbying and talking to the representatives and helping get language in different bills. And it's been a completely different experience for me, but one that's necessary to really make change, because unfortunately there's both this top down and this bottom up, right? And so educating the masses, having people know about this and demand it and do it for themselves is the bottom up, but the top down is where you really can start to impact what subsidies are given for food, what is defined as healthy food, and then how that is taught, how that is distributed, and kids' lunches, and the military, and all the things that the government has its hands in. If we can impact that to move the right direction, then it's well worth the effort.
So explain more for me about the coalition. I had Dr. Mark Cucuzella on like 2 months ago, so I know he's a member, and he was explaining it to me as well. It's still a little hard to wrap my head around. So I've been to the website, and it's just like a list to me of who's who in the metabolic health space. Is it in its core like a lobby group or education group? Or how are the members of the coalition getting out there, getting the word out?
Well, the answer is yes. It's a lobby group and an education group, and we're doing a little bit of everything. Like Mark was great in helping us write our GLP-1 position statement. Him along with Dr. Troklasian and Dr. Caroline Roberts and Dr. Mario Glant, and there's probably someone else I'm missing, and I'm sorry off the top of my head, but we came together to write a position statement on GLP-1s, put it on our website, shared it with congressmen and people on the Hill, and just trying to educate people about our position on it. So that's just one example of what the coalition is doing. And Dr. Andrew Kutnick has been really involved and very vocal about his research and about type 1 diabetes and the role of metabolic health and type 1 diabetes, which is very often overlooked. So we have that education component, we have the lobbying component. So we really are doing both.
That's pretty interesting, and it's good to know that there's people out there doing that. I'm very, of course, involved in the grassroots side because that's the world I live in. But it's nice to know that we're not just talking to nothing. That hopefully we meet somewhere in the middle with this, and that's where somebody either hears it from us, those people with a lived experience that start screaming, because we all wake up one day and just start screaming, or they're hearing it from you guys from the top down. At least somebody's hearing it. I feel like that's a good step in the right direction. So in your opinion, how long do you think it takes to create this change in a more mainstream?
That's a huge question. I mean, you read all these statements and papers that it takes 17 years from research to clinical practice. Like, no, we're not that patient. We're not waiting 17 years, no chance. So, I mean, we're already having an impact, and we'll continue to have an impact. When will it become, standard of care or, just commonplace in modern medicine? That I don't know. But every life we change, every person we reach, every doctor we can educate, we're moving closer to that goal.
And I think that we do need to get it into the more mainstream, and especially like if we're talking about healthcare costs and insurance and all of that goes along with it. But that's really going to be a slow ship to turn. There's enough of us out there who've kind of figured it out, so that if we keep talking to them, we're still helping individuals, even if that mainstream piece is going to take a long time to turn around.
Yeah, and it's interesting. I mean, look, as a lot of us see this as it has to come from the doctor and come from the doctor down, but really the paradigm is shifting a little bit, and it's not. It's coming from the coaches and the health coaches and the dietitians and the therapists and the individuals themselves, and bringing it to the doctor and say, like, look, this is what I'm doing. This is what I want to try. Can you help me with this? And I've got other people to help me with the keto part. You just make sure I'm doing okay from a medical part. Like, that's a great way to do it. It doesn't have to come from the doctor. And then that's how you can educate the doctor and then slowly change practice that way too. So I don't want individuals to think they have to wait for their doctor to bring this up to them. Like, absolutely not. Because the information is out there, you can get proactive. But if you're using anything to treat a medical condition, it should be done within, your healthcare team under careful guidance, because things can go wrong. And so you do need to be monitored for that.
Yeah, absolutely. We're not discounting the medical system altogether. It does serve a very good purpose, and we should accept that. So I'm wondering, for you, is that how, when you first got into metabolic therapies, when you were in practice, is that what happened? Because a lot of doctors say that. It was like one person came to them and said, oh, I've been doing this and this is, and then you've noticed the changes, and then you recognized it and just started going in that direction as well?
Actually, it was a health coach and personal trainer I was working with. So I had a little side gig to my cardiology job. I started a little wellness center where I just thought I needed to work with patients more, just needed more time with them, more time with with this health coach I was working with. His name's Dustin, an amazing individual. And he said on some of our sort of tricky patients, he's like, hey, why don't we try a ketogenic diet on this guy? And of course, my first response was, what, are you crazy? I don't want to kill him. I'm a cardiologist. I can't do that. Right? It's how ignorant I was, because I wasn't taught about it at all. And so he opened my eyes to it and helped educate me about it. And then started doing it myself and started doing it on, tried it with a couple patients and just saw amazing responses, and was reading the literature that already existed. And that's where I got kind of upset that, why didn't I know about this? Why wasn't I taught about this? Why wasn't anybody talking about this? And then the rest kind of went from there.
The rest is history, right? And well, I'm asking that question because it lends then back to the importance of the individual bringing it to their doctor. And I have these conversations actually quite frequently with people who are scared to bring it up, or they self-censor themselves. And I'm sure I know that I've done that myself. It's kind of hard to look up to a doctor. We're taught to look up to the doctor, and to come in with some new information and advocate for herself is very challenging. So I didn't want to brush over that and let someone think that maybe they shouldn't say anything because their doctor should know. But there's like a happy middle there where there's a conversation. What would you say to somebody who felt like they had to self-censor when they were going to their physician?
Yeah, I mean, there are a couple. I think the key is to, one, you don't have to self-censor, but you also don't want to come across as, I know better, this is what I'm doing. But instead, doctors want to help. At their core, they got into medicine. The vast majority of them got into medicine to help people. So if you portray it in a way that you can help me do this, you can help me get better, I need your help. This is what I want to try. This is the support I have. Now I need your support to help me with this experiment from the medical side, to make sure it's safe, to make sure, my medicines are okay, et cetera, et cetera. So really engage them as part of the team to work with you to achieve your health goals. And I really hope nobody would feel like they had to self-censor from that standpoint. Their goal may be that your LDL is X and your blood sugar is Y and your blood pressure is Z, but your goals are, I want energy, I want to feel better, I want to think better, I want to, I won't want to be as tired, and I want to live longer if I can under feeling that good, right? Let them know what your goals are. Maybe they're different than theirs, and then work together to have them, help you achieve your goals. I can't imagine any doctor would be like, no, I don't want to do that. I don't want to help you, right? Like that's why they're a doctor.
Yeah, I want to believe that wholeheartedly as well, that, a doctor became a doctor because they wanted to help people with their health. And I just can't even imagine how frustrating it is to be in the system where you don't get a lot of time with a patient, or you have to follow the rules and guidance of the practice that you work for, and to go to work every single day and not see hope on the faces in front of you. I mean, that's just, it's got to be a heartbreaking just realization, like a slap in the face when you realize you've dedicated your life to this and not seeing it. So I would hope then that if I came into with a conversation that said, this is what I'm trying to achieve, that doctor would want to sit and listen.
Yeah, I mean, and it's amazing how doctors have transformed their practices and their lives. Dr. David Unwin is the perfect example. burnt out, not having any impact on his patients that he would like, kind of maybe getting ready to quit or retire. And then boom, like revolutionizes his practice, revolutionizes him, has so much joy and meaning in his practice all of a sudden, which he had lost. Like that's happening more and more. And that's what we want for doctors, right? You want to see hope. Like you said, you want to see your patients getting better. You want to see yourself having a role in that impact of them getting better. So why wouldn't you?
Yeah. Why wouldn't you indeed? Except for that this whole like medical conglomerate that you might work for is kind of putting the thumb on it. And that's where I'm going to allow the coalition to come in and help make these changes. Certainly beyond my scope. I'm just going to bang my little lived experience drum over here and hope that works out. So how do you see, let's transition. How do you see things like the cholesterol code film fitting into this overall vision?
Yeah, I mean, just when you look at the Citizen Science Foundation and COSI and the cholesterol code, it's all about saying we don't know everything. Medicine does not know. There is no settled science, and we need to be open to people's personal experiences, opening the door to other alternatives, and then research. Like medicine should be researching this. It shouldn't take an engineer completely outside the medical world to come in and make this research happen about this fascinating subset of people. But because it has to do with what we quote unquote already know, medicine had closed eyes to it. But now Dave and his team has opened eyes about like, what is this lean mass hyperresponder and what are the true risks and benefits of ketogenic interventions, not just, oh, that's dangerous because your LDL might go up, but what benefits are we seeing? How are we changing lives? Like, so important to get that message out there. So I really see the, cholesterol code as having a number of different points to it. One is, personal experience is so important and we have to listen to it. Two is we don't know everything and we have to be willing to admit that. And three is we have to really be able to see benefits and risks together. And that's where, the personal experience really tells us about those benefits. And four is, if medicine isn't getting it done, somebody needs to come in and get it done. And that's what Dave's doing. And that's what a lot of the funding from Bazooki Group is doing as well, right? Funding this research that isn't being done, that really needs to be. And then the importance of storytelling. I mean, and it is important to get that out there and tell it in a way that touches people and people can really understand and engage with. And they're going to be haters, right? They're always going to be haters. And it's amazing how many haters have come out of the woodworks about Dave and his team and the research. And look, nobody's perfect, right? There have been missteps along the way, but the reaction has been so egregiously aggressive, I think. And it's because it questions a lot of dogma that people have believed and thought were settled for decades, and maybe it's not.
Yeah, Dave comes in out of nowhere and starts pushing people's buttons.
Mm-hmm.
But he did it with integrity and intense curiosity, and that's what is needed, and that's what's been missing from a lot of scientific conversation. Is one answer should actually lead to another question, should actually lead to another question. Yeah, and he hasn't been seeing that.
Right. So for all the critics out there, everybody who thinks this is a waste of time and a fool's errand and we know all the answers, I hope they get a chance to watch the documentary. It may not completely, convince them that, it's not they're wrong, we're right, or anything like that. But they can see it from a different perspective and just maybe soften a little bit and say, okay, maybe we do need to look a little bit more. And, it doesn't answer all the questions. It's not to say this one documentary is going to change everything and answer all the questions. It's going to ask a lot more questions than it answers, but that's what we should be doing. We should be asking these questions.
Yeah,
because exactly. It's real lives we're talking about.
Yeah. And I appreciate that a lot, actually. I mean, honestly, I've been through it on that side, on the patient side. So like going into conferences or reading studies or hearing about studies and them now putting like a little lived experience blurb in a study. Now I've been a part of a couple of those where it's asked me to write, would you like a question like, would you continue eating this way, or do you plan on continue eating this way, or how has it made you feel, to kind of include that in the literature. It's not just, well, what always bothered me was at the end of the day on these studies, say we're doing a study on statins, at the end of the day, there's a person that has to take that medication and has to live with that, and whatever the minor side effects might be, it actually will affect someone's life. And it seems like there's been a really big departure from the human side of science. So, oh, sorry. So what I really appreciate from Dave's work, and then ultimately what happened with the film, is that it brought the people in. It showed those stories. I know, because I'm one of them, but I'm only one of many stories that appear in the film that really tie together. If we don't study this, then what do we do with this person over here? How do we handle this person? And it's not to say that there's not people who aren't taking medication. There are people in the film that are taking medication for an issue. It's not saying this is the clear-cut answer. You fit in this subset, and so you're home free. You don't have to worry about anything. That is not at all what this is about. Yet when the detractors started coming out, that's really what it felt like. It really felt like, yeah, you guys are telling people to do something that's going to ultimately kill them.
Right. Right. And you're right. It's got nothing to do with that. That's not the direction or the intent at all. So people are going to see what they want to see sometimes, unfortunately. Yeah.
Yeah. That's very unfortunate. And I had Dave on not shortly after the release of the data from, not from Clearly, what came after. Clearly was HeartFlow. Yeah. So I had him after that. So we talked about that time in between, and it was just such a strange time. And I understand that some of that's being discussed in this newest version of the film. So I'm looking forward to hearing what those additional, I guess they had to add a chapter. So I'm looking forward to hearing that added chapter, because it's gonna answer a lot of questions that I think people still have in their head.
Yeah. I mean, that's kind of unfortunate how that data came about, and some is more accurate than others, but that happens. You got your research is only as good as the data collection or the data analysis, I guess. And yeah, so there's a lot coming out about that. And I think people are going to be, hopefully, have their eyes opened to maybe some errors that were made, and maybe the data looks a little different than they thought.
Yes, exactly. And these things don't happen for no reason. Like now, in talking to him, he knows how he's going to go forward with the next step and the things that he needs to put in place for the next step. Yes, all of that was unfortunate, and it caused a lot of tension, especially in social media, but it was still very much a learning process for what's to come and how I'm going to handle it in the future. So, everything happens for a reason, even if it is ugly at times.
Right.
So what exactly is your involvement in the film? Because I think, were you the medical director for the film as well?
No, I was just in the film.
Just in it?
I was in the film, and I guess I'm a consultant on the film, just to make sure a lot of the, the phrasing and the terminology and the way we talk about things, that it's just, it's accurate and it's trustworthy. And so I had a little bit of a role there, and certainly was interviewed for the film, and very, very thankful to be part of it. Very, very blessed to be part of it, because I think it really is so important for all the reasons we've talked about.
Yeah, I agree. Yeah, I very much enjoyed the short film that they put out of you with outtakes. I'm glad you could have a sense of humor about such things.
Yeah, no, that was great. And I really think about it. I mean, Dave and I started talking about this back in like 2018 or 2017, even like back when I had the low-carb cardiologist podcast, even before my diet doctor days. I think I interviewed him and we talked about this. So we've been together working through this for a very long time. I'm really impressed with all that he's accomplished and his passion for this.
Yeah, he needed a group of people that would listen to him. So that story of him running around with his laptop at a conference just to get a little time with somebody, it's just amazing how this community just received that, because none of the other community, I don't know that there's any other community out there that would receive it and say, hey, yeah, let me give you some time and listen to it. And then look what it's become from there. It's absolutely amazing. It's very big. So, and it's pretty interesting to know that, you know, you and many others helped kind of form that conversation for him so he could, I guess, drill down on what was important. I mean, he's not a lipidologist. He doesn't know the stuff. I'm sure he knows a lot. Obviously, he knows a lot more now, but he needed guidance for people who knew those things. So, yeah.
Right. He's a smart guy, that's for sure.
Well, I was going to mention this. I had met you at Low Carb Denver, the very last Low Carb Denver that they had. And I think at one point they were like, we all look up to these doctors. And I think Dr. Westman said, except for you, Bret. And so I ran up to you afterwards and I was like, I look up to you. And so you just need a few more short people in the world. And I got you there.
All right. I like it. I like it.
I don't want to hold you for too long. I just really wanted to talk about, you know, I was really infinitely curious about Coalition for Metabolic Health because I know it's new and it's been a little hard to get information about that. So since you were here, I certainly wanted to pick your brain about that. But then I also wanted to talk about your experience on the cholesterol code. But I certainly don't want to keep you beyond the time that you have available.
Well, thank you. I mean, I really appreciate you, taking the time to talk to me, and again, for all you've done, sharing your story and all the lives you've touched is really remarkable. So thank you.
Well, it's hard to grasp that. I mean, I say it all the time, like if I just help one person, it's all worth it, but it's starting to come out of the woodwork that there's a lot of people out there who are listening, and it's a little overwhelming, but it also brings quite a bit of joy. So I'm just, very thankful to be part of the whole process. So yeah, if that little bit helps, and I think it too, but it's my family, right? So I'm looking at the big screen and I'm seeing my daughter, and I'm so intensely proud of her for being. I have a son also who was in the house the whole time we were filming and didn't want anything to do with it. Our relationship is fine. He just doesn't talk openly about these things. But to see my daughter, who is younger, have the strength and courage to talk about things is, it fills me with pride. But to hear other people, so I think, our story is a pretty major theme, but I might be a little biased. So when I hear that from other people, it means a lot. I know that when she says what she says about remembering me as a child, you could hear a pin drop in that theater that day.
Gosh, that was such a dramatic moment and such a poignant moment.
Yeah, so it still makes me tear up thinking about it, and I get to see it several more times. So, but thank you. It just means a lot. It means a lot that we were involved in the project, and it's a surreal moment, certainly for me. Like I said in the beginning, I'm not used to. I talk to people, it's like their first time telling their story out loud. So to talk to somebody like you, to me, someone I've really looked up to, is a surreal experience. To be in the movie with credits with my name and next to these names is very surreal. So, we had 2 years since filming, and to be where we are now after that 2 years it's getting very intense for me. I'm not sure how it is for you, but that's how it is for me.
Yeah. Well, great. Well, thank you again. I really appreciate the opportunity to come on and talk to you.
Yes, I appreciate you as well. So thank you, everyone, for joining us for our Ketobiography. Bye.